Hi, my name is Adam Money, orthopedic sports medicine, operative side. I grew up playing sports. I played football in college. I always knew I wanted to be a doctor. I realized that I could still be involved in athletics by being an orthopedic surgeon, specifically involved in sports medicine, so taking care of athletic teams. So I like to joke that I just graduated grade 26 coming out of fellowship, and you want your doctor to have gone through many years of training before they ever decide to operate on you or make an incision on you. And so I think that extra level of subspecialty care, really being focused, allows you to become an expert in that area. I think the biggest thing in building the physician-patient relationship is you just treat them like a normal person. You treat them like a family member. Whatever I'm offering that patient, would I offer this to my cousin or my uncle or my mom or dad? The best part about the job is being able to take something that you don't think is that complicated as a physician, body part, anatomy, an injury, and being able to sort of break it down so that the patient can understand and make that decision with you. Part of training to be an orthopedic surgeon is learning all the things to be able to help somebody without making an incision on them. However, there is a time and a place where surgery will provide a long, life-changing outcome for individuals. If you suffer from rotator cuff tears, labral tears, ACL tears, I'd love the opportunity to provide quality care for you.